Are there things that you see parents doing or not doing that can land their child in the ER?
I think the biggest thing would be, one is identifying triggers and avoiding them. The second one would be compliance with medication. So if you have a patient that's been diagnosed with asthma, being compliant with those medications is very important because if you're not decreasing that level of inflammation in your lungs, they're going to be more sensitive to certain triggers. And if you don't have that controlled, then they're going to end up in the emergency room where it may be harder to control once you've gotten to that point.
Do you have any advice for parents for talking to their child about asthma?
I think just it may be hard for a child to really express how they're feeling, or they may not be able to tell you that they're having difficulty breathing or that coughing's bothering them. But just bringing it up, talking about symptoms, and at school if they're having trouble keeping up with other kids and keeping up with in gym class and things like that, just asking questions like that. I think comparing it to other peers, if you have two kids in school and one's able to run around the playground and one's not, trying to figure out why that might be.
Is there any other advice you would give parents of children with asthma today?
I think one important thing is that, not having children around smoke, secondhand smoke. I think children that have exposure to tobacco smoke have a higher risk of developing asthma. And then they also have more severe asthma symptoms and have more frequent exacerbations. So, they should always discuss smoking habits with parents and caregivers and pediatric patients especially.
Thanks again for being with us, Dr. Patel. If people listening today want to keep up with you, what's the best way to do that?
Absolutely, yeah. They can call our office, 614-328-9927. Also, we have a website, premierallergyohio.com. They can, send an email that way also.
Great. Thanks so much for being with us today.
Great. Thank you so much.